Can your hormone levels be rehabilitated? Hi everyone, my name is Dr. Perman and I rehabilitate concussions, migraines, and dizziness. So in a previous video, we discussed how we go about assessing hormones in relation to migraines with a urinary and a salivary panel. If you haven't watched that yet, please go check that out. But today I want to talk about how we go about rehabilitating hormones with our migraine patients. Now again, the traditional way to work on hormones is through hormone replacement therapy. And that is an option, but it's not my favorite option. And the reason why is because it artificially modulates your hormone levels. And it might make you feel better, but it's not actually fixing the underlying issue. So when we're going about working hormonally with our patients, it's not as much about hormone replacement, it's more about giving the body the tools and building blocks that it needs to properly coordinate and run your endocrine system. So as an example, if you're low in estrogen, we need to figure out, why are you low in estrogen? Is it because your body is not producing enough of that estrogen? Or is it because your body is breaking down that estrogen too quickly? Through our salivary and urinary panels, it allows us to start to see the full picture of things. From there, rather than just giving you estrogen to get your estrogen levels even, we instead give your body building blocks to allow it to create more estrogen on its own. Now your body is able to actually create the right amount of hormone and keep your body functioning the way that it is supposed to. Now the main question that I get when I take patients through their hormone rehab protocol is, well, do I have to be on these supplements forever? And the answer is usually no. The whole goal of hormone rehabilitation is to give your body the building blocks that it needs to reset your hormonal cycle, and then over time we start to wean you off of those supplements in hopes that your endocrine system starts to function the way that it is supposed to. Now, one of the most common questions we get is, okay, well, do I have to be on my hormone rehabilitation protocol forever? And the answer is usually no. Most of our hormone rehabilitation cases take somewhere between 6 months and 2 years. Once we feel like we've made the change that we're trying to make, we begin to titrate you down off of your supplements to the point where you're not having to take anything anymore. The great thing about hormone rehabilitation is that there typically are very mild, if any, side effects. Now, the downside of it is it oftentimes will take a little bit of time for things to kick in, because we're not trying to just nuke your system with hormones. We're trying to give your body those building blocks, so it can take some time to start making the change. But once we've made that change, it should be relatively permanent. So we see how little supplements you can be on in the long term to keep your hormone system functioning at optimal potential.